All right, hi. So welcome to this video all about GAPS. This is a video that's all about the basics of GAPS, what it is, what GAPS stands for, who has GAPS, what do we do about GAPS, just kind of a basic overview of GAPS. So if you're somebody who's heard about it, but you don't know too much about it, if you are thinking of starting on the GAPS healing protocol, but just want a little more information, then this is a perfect place for you. So thanks for being here. My name is Hollie Bigham. I am one of the practitioners with Be Well Clinic, and I really love GAPS. I'm a certified GAPS practitioner, and I practice GAPS with a lot of with my patients, with the majority of my patients right now, because GAPS I have found to be so healing, both in my personal life and with patients of mine. That is something that I just love to bring other people into. All right, so what is GAPS? That is our topic today. Real quickly here, who am I? So why are you listening to me today? Why am I the one presenting this? So here's my family. We don't have an updated family photo, so you're getting kind of a piecemealed family photo here, and it's pretty old. So this is me, my husband, Jared, and my 3 children, Magnolia, Everett, and Juniper. I'm a registered nurse. I've been a nurse for 12 years. I worked primarily in the emergency department for about 10 years or so. And when my daughter was born a little over 5 years ago, I suddenly got a ton of my own health problems. I was very healthy before, never really had any mental health issues, physical health issues. I was really active, felt really confident in my body. And then after she was born, she had to be in the NICU for several weeks. She was very, very sick, and I developed a pretty bad PTSD, anxiety. I started losing my sight, had very bad migraines. I started not sleeping and actually hallucinating for about every 30 seconds. I'd have a hallucination around the clock, day and night. I lost the use of my hands. I couldn't feel my hands anymore, and randomly they would just go numb and weak, and I wasn't able to hold things. So for me as a new mother for the first time, for anyone, this would be scary, but especially in that time of life with my daughter being really ill, with me developing all these very unexpected symptoms, I was at a loss. I talked with some of my colleagues at the time when I was working in the ER, and they mentioned maybe I had MS, maybe I had a brain tumor, and suggested going down the route of a lot of experimental drug trials and different kinds of testing and that kind of thing. And I didn't want to. I thought, this is ridiculous. How in the world could this happen to me? Why right now would suddenly I have a brain tumor? Like, how in the world is this happening? So I decided to just go ahead and look through my own, how I could heal myself on my own. Is there anything that I could do at home by myself to treat my symptoms? And I found that, yes, there is, actually. So a friend of mine wound up telling me about a Candida diet, which is a diet that's very specific to kill off an overgrowth of Candida or yeast in your gut. Once I started looking into that, I realized, oh my goodness, the gut is important with all of this. All of my symptoms are probably because my gut is unhealthy. And that took me down the path of GAPS. So after about 2 weeks of changing my diet, and changing my diet very specifically to heal the microbes in my gut, I lost all of those symptoms I was talking about. I had experienced them for about 3 months, and after 2 weeks, they were all gone. I was able to have my little girl at home. She was getting better. I was better, and I decided to go back to school, become a functional nutritional therapy practitioner, and then a certified GAPS practitioner to be able to help other people who are going through something similar to me. So that is my journey. I had 2 other kids since then. None of those symptoms returned. And so now I'm just preaching GAPS and preaching gut health. All right. So many, many centuries ago, Hippocrates said that all disease begins in the gut, or at least that's what is rumored to be said by him. So this is something that's still true. This is something that modern medicine has forgotten. The gut is very rarely seen as the cause when there is mental disease, when there is autoimmune disorders. Most Western modern medicine does not start digging into the gut to see what's going on with the gut to be able to heal the rest of the body. However, it is true that all disease does begin in the gut, and this is the premise that GAPS is founded on. So GAPS, GAPS, stands for two different things: gut and psychology syndrome and gut and physiology syndrome. So this is talking about the gut. The health of the gut, or the digestive system, factors into the health of the mind, the psychology, and the health of the rest of the body, the physiology. A lot of times, if you are somewhat familiar with GAPS, when you think of GAPS, you think of the diet. But this is actually what GAPS stands for. It's the gut and psychology syndrome and the gut and physiology syndrome. And then we get to the GAPS nutritional healing protocol. So then we take that, the relationship between the gut and the mind and the gut and the rest of the body, and bring in this healing protocol that we use nutrition for, because we're talking about the digestive system. So of course we have to talk about food, right? Okay, so what is the purpose of the GAPS nutritional healing protocol? Well, there's a couple things. First of all, we heal leaky gut. That's what we're going to talk about in just a little while, but healing leaky gut first and foremost. Once we heal leaky gut, then we heal the rest of the body, both the mind and the rest of the body. When we do this, then we see a reduction in symptoms, whatever symptoms you're coming for, whether it's digestive symptoms or joint pains or heart disease or mental disease, a huge slew of things that we'll talk about. But once we heal the leaky gut and start healing the mind and the rest of the body, then we reduce symptoms, and then whoever's going through this is able to live a thriving life, a life that before, when they were riddled with symptoms, they had no idea they would be able to actually live a life so thriving. So that is the goal. That's the purpose of this, to heal so that you can thrive. Okay, so leaky gut. If we're going to heal leaky gut, let's talk about what it is, right? So leaky gut, first we have to talk about the digestive system. What is it? So we're going to talk about this tube, a really long tube that starts in the mouth and goes down the esophagus, the stomach, through the intestines, and then to the rectum. So it's one long tube that's open on both sides, right? There's a lot of different things that factor into the digestive system, like the liver and the brain and so many things. But when we talk just about the digestive system, that tube, this is what we're talking about. And all throughout that tube, there are microbes. There's beneficial microbes, there's pathogenic microbes, all different kinds of flora there in the digestive system. When we talk about the gut, what we're really talking about here is the intestines. So the type of flora, back to our slide here, the types of flora, there's three different ones. There's the beneficial bacteria, there's the opportunistic microbes, and then there's the pathogenic microbes. So beneficial bacteria sounds exactly like what it is right here. So the beneficial bacteria are they are all throughout the intestines, and they are supposed to be there for a variety of reasons. They are feeding the enterocytes. The enterocytes are the cells that line the intestines wall. And so they're feeding them, they're providing them with nutrition to keep them really healthy and happy. And you can actually see here in this little cartoon picture that's taken from one of the GAPS books, this that's a healthy enterocyte with the happy face and all the hair sticking straight up. And then there is a sick enterocyte that looks really sad and decrepit and old and wrinkled, and those hairs are no longer standing straight up, but they're just kind of wonky all over to the side, right? So kind of a silly picture, but this is actually a pretty accurate representation of a healthy enterocyte, the cell lining the gut wall, and a sick one. All right, our beneficial bacteria are really responsible for helping to have a strong gut wall, and that's because of these enterocytes. They're also instrumental in strong immunity. When the gut is healthy and the beneficial bacteria are strong, then we see really great immunity, because the vast majority of our immune cells are actually born in the gut and live in the gut. Strong beneficial bacteria also help with vitamin production. So the body actually produces many of its own vitamins, and especially a lot of the B vitamins are produced in the gut. And so if we don't have good gut microbes, a good balance of the microbes with beneficial bacteria being strong, then we'll actually have really poor vitamin production. So then if you're not taking it in and absorbing it well, then you're just not going to have, you're going to have a vitamin deficiency. And then digestion and absorption, beneficial bacteria are really important for digesting the food. They help to actually break down the food so that we can absorb the nutrients in the food. All right, let's talk a little bit about, so we talked about these enterocytes, and we're going to look at the lining of the gut wall. So here you can see these, they're called finger-like projections or villi, and they are all throughout the gut lining. This is what the wall of the intestine looks like. And these help to keep the wall strong and decide what goes in and out of the wall between the blood vessels, and the intestines. Now, if you can see all along these villi, are these little circles and kind of a shadow. Well, those are the enterocytes. It's kind of hard to see on this picture, but those are the enterocytes. So all of them are lining all along the villi, and then they have their really nice, straight, healthy hair sticking up, and they are providing a strong, cohesive wall. Those hairs actually help determine what goes in and out of the intestine wall. And so when we have our nutrients, they determine what nutrients are allowed to go into the bloodstream and what needs to stay in the intestines and get broken down more or just passed through. So you can see when you have these healthy hairs, they're creating a really great barrier. If those enterocytes are sick and the hairs are just kind of going all over the place, but not nice and cohesive and strong, you're not going to have a really healthy barrier. All right, now look down at the bottom of this slide. You can see on the side, on the right-hand side, it says crypt. Now, going on to the next one, the crypt is where these little enterocytes are born. So you can see on the bottom, it says the maternity unit. So down in the crypt is where these enterocytes are born. The way that they're supposed to be, when there's strong, beneficial, healthy bacteria, the enterocytes are born, they're happy, they're strong, they are young and vigorous, they travel up their whole life, they're just traveling up the side of the villi, and then when they get to the top, they've lived their life, they've done their job, they get old, they die, and they fly away, or they are shed off. This is how it's supposed to happen. However, when the beneficial bacteria are not strong, it doesn't go this way. Let's look over here. All right, so when the pathogenic microbes are strong, these are the disease-causing microbes in the gut, when they are strong, the enterocytes become sick. So they're born sick. They're not nourished well, and they travel slower. And so instead of being really healthy as they progress all the way up the villus, all the way to the top, and then finally, getting slower and older and then dying, they start way earlier down. So they're born not really happy with those hairs sticking straight up. They're born looking pretty decrepit, looking pretty sick. They only make it part way up the villus before they are too old and they die. And so that leaves a lot of the villus or the villi exposed. So as we go down the slide here, so the hair-like projections do not filter well. The absorption of nutrients decrease because those hairs are the things that are helping to absorb and to figure out what goes through the gut lining. The tight wall junctions loosen and the wall becomes porous or leaky. Like we were talking about, they're not all there nicely tight together, but rather they are they're loose junctions, and they become leaky. That makes it a leaky gut wall. There's nutritional deficiencies because we're not absorbing our nutrients. The immune system suffers because the pathogenic microbes are stronger than the beneficial microbes at this point. And so the good immune system, which is generally fed and nourished by the beneficial bacteria, it suffers. And then we start having a lot of symptoms. We'll go through those symptoms in a little while. Now, we mentioned 3 different kinds of flora, right? We mentioned the beneficial bacteria, the pathogenic microbes, and then also the opportunistic microbes. Now, opportunistic ones just go to whichever side is stronger. So if the beneficial bacteria is stronger, the opportunistic will join and make them even stronger. If the pathogenic microbes are stronger, those opportunistic ones will just go on over and join those and make you even sicker. So we want to make sure that we really have that strong beneficial bacteria. So the opportunistic join them and they become even stronger, healthier, and helping a person to thrive, rather than all of these things here on this slide happening when the pathogenic microbes get bigger and stronger. All right, so leaky gut. So let's talk about this a little bit. When the wall is porous, which is kind of what we just talked about in that last slide, now there's holes in it. So things can get through. Those hairs, those strong hairs are not guarding what goes in and out anymore. It's just open. It's left open. And so undigested food particles are able to travel through that gut lining right into the bloodstream. Now, appropriately, the body sees this and just says, well, hey, that's not supposed to be there. There's some giant foreign body in here. I don't know this. I don't recognize this. This is probably something that's coming to cause disease. And so the body starts attacking it. And it attacks it. Remember, we talked about the immune system is now compromised, right? So the immune system is not working as it should, really organized, using the right tools, bringing the right ammunition and weapons to the fight, but rather it's what's called second-tier immunity that comes, and it just comes in with this hyper response saying, we don't really have the right tools because that first line of defense is damaged. They're not here. They're not the ones coming. We just have to come with whatever we can. And so it causes this big immune response, kind of a big like an allergic type response. And then this is where we get symptoms. So that allergic type response can attack all different parts of the body, depending on which kind of food, undigested foods go through, depending on which areas are more weak. It can the immune response can attack the brain or the joints or the muscles or the small intestines or the pancreas, and that's where we start getting all these different kind of autoimmune issues, disorders, symptoms. And it's because of the body trying to do its best. The body has not just gone haywire and gone crazy and started failing at what it's supposed to do. No, the body is trying to deal with the situation that it's been given, right? And so the body's saying, all right, you know what? The first tier immunity is not there. It can't do its job. we're going to just throw everything we can at it. And so it's trying to attack the foreign bodies in the blood, but just doing it in an inappropriate way because it doesn't have the tools. We haven't provided the tools that it needs. All right. So in gaps, both the body and mind are always affected in gaps. So a lot of people say, well, I have Crohn's disease, or I have a digestive issue, or I have joint pains or diabetes type 1, but I don't have mental disease. Well, in gaps, the body and the mind are always affected. So maybe you are just having symptoms of more of the physical right now, but later on would come the more mental issues. Or you could say, well, no, physically I feel fine. I just have anxiety, or I just have depression or ADHD, but I feel fine actually physically. Well, again, both the body and mind are always affected. So maybe you're feeling some symptoms more than others right now, but there is that underlying gaps. There is that underlying leaky gut, and you will develop those other symptoms later on if you don't stop the leaky gut in its tracks. Okay, so common symptoms in people who have gaps. These are symptoms. This is not a comprehensive list. There's tons of symptoms, but these are ones that I see very frequently in my practice. Eczema or other skin issues, anxiety or depression, bipolar and schizophrenia, chronic diarrhea or constipation or both, abdominal pain and bloating, chronic fatigue, PMS is really bad, menstrual symptoms, fibroids, autoimmune disorders, seizures, poor sleep, and brain fog. And again, there are so many more. These are just kind of ones that I very, very commonly see in my practice. Okay, so there is good news, right? We just talked about all these terrible symptoms and the body being not working the way it should and the leaky gut, but there is good news. We can heal. A lot of times we are told by just kind of the modern way of thinking about the body that so many symptoms you can't heal from them. We don't know what's causing them necessarily, or maybe we do, but you can't heal from it. You can take a medication and you can help to lessen your symptoms, but there's not healing. But I'm here to tell you that yes, there is healing that can be found when we heal the gut. We can find healing. Okay, so how do we heal the gut? Well, there's basically 3 different things that we need to do. We need to stop the offending agents. So what is it that's actually causing the pathogenic microbes to be stronger than the beneficial bacteria? We need to stop those offending agents. We need to nourish the beneficial bacteria to make them the stronger ones. And then we need to patch up those holes. So those holes in the gut lining that has been allowed to just kind of relax and we don't have those hairs and the strong enterocytes, we need to patch up those holes so the undigested food particles are not going right through the wall and causing this big immune response. All right, so if we need to get rid of those offending agents, what are they? Okay, again, probably not a comprehensive list, but these are what I typically see. So processed or fake foods, so foods that have food coloring, food dyes, foods that have been changed in the way that they were cooked and made into be puffy like cereals, foods that are, just come in packages that aren't really foods. Like, where in the world does that come from? They have tons of different chemicals in them to make them flavorful and quote unquote edible. But the processed and fake foods, huge offender. Sugars, really big offender. They're inflammatory, they hurt the vessels, and they directly feed the pathogenic microbes. Synthetic chemicals, like things in body products and cleaning supplies, etc. Medications, vaccines, nutritional deficiencies to start with. So if you're not nourishing your body well in the beginning, then you're not going to, then you will start building up the pathogenic bacteria and microbes. Stress is a really big factor with this. Pathogenic microbes that have been passed down the birth canal. So this can even start right at birth. When a child is born, if the mother has pathogenic microbes there in the birth canal that were either stemming from her or stemming from the father, those can be passed down to the newborn. Formula, like infant formula, is riddled with offending agents. And then environmental toxins like pesticides, different chemicals in the water like chlorine and fluoride, different things like that are in our air, our water, all around us. So we need to remove those offending agents. Then we need to nourish the beneficial bacteria. So how do we do that? We do that with probiotics. And these can either be commercial, like a capsule that you would get, or through food, like a fermented food, such as sauerkraut, kimchi, anything that's fermented, fermented radishes or garlic or onions or carrots. We ferment everything in my house, or cultured dairy. So yogurt, kefir, sour cream, creme fraiche, anything like that. All of these, the commercial ones and the foods that I mentioned, are probiotics. They're filled with good beneficial bacteria. And when we add those into the gut, it'll help to support the bacteria that we have and the beneficial bacteria that we have to grow and get those opportunistic microbes to come and join forces with our beneficial bacteria. Okay, and then we need to heal and seal the gut lining, which is patching those holes. We do this with meat stock in gaps. So with meat stock, which is not bone broth, the meat stock is full of gelatin, collagen that helps to come in and really heal, seal, soothe, and patch up the holes that are there in the gut. So meat stock is not bone broth, and this is a really important distinction to make because bone broth while full of minerals, can be really nourishing. If you have not healed your gut lining, it can actually be more irritating to your gut. So we want to make sure when you're doing meat stock, you're using meaty bones. So you're not just taking just bones, right? In bone broth, you have your bones that you collect in the freezer. You stick them in the freezer and you just keep collecting until you have enough and then put them in a pot. That's not what we're talking about. We're talking about meaty bones. And we generally want a ratio of about 80% to 80 to 20, 80% meat to 20% bone. We want there to be joint bones in there because that's where most of the collagen, the gelatin lives. And then it's a short cook time. So bone broth, a lot of times you are sitting simmering on the stove or in your crock pot for, up to 72 hours. That is not what we're doing with meat stock. With meat stock, we want to do a short cook time. So with a chicken, it's about 2.5, 3 hour cook time max. With beef, it's more of a 6 to 8 hours. So we're not doing these multi-day kind of simmers. And then lastly, it's a small amount of water. So instead of putting your meat, your bones in a pot and then filling it all the way up with water, you're only doing about 2 inches of water above the level of the meat. So we want to be concentrated, thick, gelatinous. So those are the 3 biggest distinctions. On the Be Well Clinic website, we do have recipes for chicken meat stock and beef meat stock, so you can find those there. All right, so we talked a little bit about the meat stock and the ferments, but let's talk more about the actual GAPS diet, the GAPS healing protocol. So an overview of it, there's 2 different ways, 2 different main ways to do the protocol. There's the introduction, and there's introduction GAPS and full GAPS. We'll talk about these in just a little bit. The food criteria, what we want is just that the food is whole foods, properly prepared, that they're easily digestible, that they're very nutritious and we can absorb those nutrients, and that they're healing. So that sounds great, right? What else would you want in a food? All right, length of time. So the length of time in GAPS is designed to be a 2-year process. So if you think about the length of time that your body has been having symptoms, or that your pathogenic bacteria have been growing, that your beneficial bacteria have been suppressed, it's probably a really long time. A lot of people actually, it stems right from the beginning of their life, and they might not notice symptoms until later, but it's usually a very long time. And so it does take a significant amount of time, like 2 years, to really heal, to restart the body, to get the liver working again, to get the digestive system back where we want it to be, get the immune system back where we want it to be. It takes a while. Now that said, 2 years, that is generally the span of introduction GAPS and then full GAPS. It's kind of this whole, the whole spectrum, not that you need to be on one stage for 2 years necessarily. However, everybody's healing time is different. But you should know that if you are bringing yourself to do healing through GAPS, you need to give it a significant amount of time. And then the end goal is to heal. Okay, this is not just an elimination diet where we're saying, okay, well, sorry, you can't ever do dairy again, so just take dairy out and then you're good. Or you can't ever do gluten again, just take gluten out. Or you can't do nightshades like tomatoes and peppers. No, this is a healing protocol. And so the goal of this is to heal and seal the gut so that sometimes if something comes into your body that is not on the protocol or not a wholesome food, your body will take it in and realize, hey, this is not beneficial for me. I'm just going to get rid of it. And you're not going to have, your gut lining will be healed and sealed so it doesn't go through, particles don't go through the gut, the bloodstream doesn't absorb those, the immune system doesn't create this giant attack. You don't have a huge response to a food that may have caused a huge response before. Rather, you are healed. And so the food comes in, the body absorbs what it can from it, the rest passes on out, and you're okay. All right, let's talk about the 2 different places to start GAPS. So there's introduction and full. So the introduction GAPS is 6 stages. It's pretty intense. This is the most, you eliminate the most right off the bat. You introduce the most healing foods right off the bat. So this can be a pretty intense time. Now, everybody has a different time when it becomes more intense for them. Some people, stage 1 gets them right away. Some people it's stage 3, some people stage 5. Like, it kind of depends on what your body needs, the cleansing, the building that your body needs. But this is a pretty intense time. Die off. Die off is the term that sounds terribly scary, but it's actually a really good thing. So die off happens when we are healing the gut and therefore killing off the pathogenic bacteria. Now, when those or the microbes, so when those microbes are dying, they are toxic and they actually release toxins into the body. This is a good thing that they are dying, but as they die off, we can have some more symptoms. We can have some more abdominal pain. We can have some more mental health symptoms, kind of depending on what is your weak point. You may notice die off, skin issues, eczema, that kind of thing. But remember, this is not a bad sign. This is not an allergic reaction sign. This is not a sign that things are not going well. This is a sign that we are targeting the right things, that we are killing off the right things. And they're just angry that they're dying, but we'll get through this. So you can decide, is this too intense for me? Do I need to just kind of back off a little bit on those healing foods, the probiotics and the meat stock, or can I push through? And that just depends on you and your lifestyle and what's going on. If you need to be taking care of kids or on a work trip or whatever it is, you need to decide, can I push through this die off? Do I have to make it a little more gentle on myself? But remember, it's a good thing as we're killing off those microbes. All right, length of time we already talked about. In general, the length of time, the 2 years for gaps, but as we go through introduction, the stages are different lengths of time. Roughly 5 to 7 days we want to spend on a stage at least, and then you listen to your body. So after 5 to 7 days, then you think through, okay, is my body ready to go to the next stage? And if so, you try out the next stage. You just do one of the additional foods, and you try it out for a few days. Are you having more symptoms? Or is your body ready for this? If your body is ready, you're not having worsening symptoms, fantastic. Then you move on to that next stage. If you introduce a new food and you're like, you know what? I'm having more bloating. I'm having more constipation. I'm having, X, Y, Z. Then you can just go right on back to your previous stage, give your body some more healing, about 3 or 4 days more on that stage, and then try it again. So everyone's a little bit different, but each stage we want to be at least 5 to 7 days. All right, now the foods for each stage. So these are, there's a lot of different things here, but basically what I want to show here is that we are building upon each stage. So stage 1 is primarily this homemade meat stock, whey if tolerated. And there's a sensitivity test that we do on gaps where you can see, okay, is this something that my body is going to be okay with, or am I going to have a big hyper immune response? And that's outlined in the GAPS books, and we do have a video about that as well here on the Buell Clinic website. All right, the homemade soups with the vegetables and the boiled meats. So when you're making your meat stock, you're putting in vegetables, you're putting in the meat, right? The 80% meat, 20% bone. And so you can eat all of that. This is not a weight loss program. We are not trying to reduce calories at all. We want you to be eating as much as you possibly can of all of these allowable foods on your stage. Cartilage, marrow, and meat close to the bone. These are the most nutritious parts of the meat and of the animal. Ghee, butter, and sour cream if you're tolerating dairy. And if you're questioning that, then you can do the sensitivity test. Homemade fish stock, fermented vegetable juice, fresh ginger, mint, or chamomile tea in between meals. Otherwise, just drinking water. And then a limited amount of muscle meats that have been boiled in that stock. All right, so those are the ones for stage 1. Then stage 2, we just build on that. So then we add in some raw egg yolk, which is so nourishing, so good with high healing fats and rich in vitamins that are really necessary for healing. And then you can also add in fermented fish or gravlax. Stage 3, you add in scrambled eggs. So now you're adding in the egg white, not just the egg yolk. You're doing the fermented veggie pieces. So before, when we were just doing like a sauerkraut juice, now you can actually do the cabbage and avocados. Stage 4, we're adding in more foods. We're doing some fried or baked foods. Now, fried is in very, very specific healthy fats like tallow, lard, ghee, bacon grease, those kind of things. Fresh pressed juices. When we start stage 4, this is where we really start the cleansing aspect. So stages 1 through 3 are the really healing, building up stages. Stage 4, 5, and 6 are the cleansing stages. So we add in more of these, the juices and the vegetables and fruits that are different, raw, to help with the cleansing aspect. And then stage 5, we're adding in more. We're doing some more raw. We're doing some cooked fruit. We haven't done fruit yet, so we're adding those in, some dried herbs. And then stage 6, you're bringing in some raw fruit, and increasing the amount of honey and honey sweetened treats that you can have. Right after this is where we go into full gaps. So once you've gone through these stages and your body is doing well with each of these stages, then you can move into full gaps. Now, some people actually start on full gaps instead, and there's a reason for that. Let's go on here. So, again, intensity. This intensity is totally dependent on your body. So if your body is really struggling, and even if you start on full gaps, it can be really intense for you. This can be the more gentle place to start, and usually is, but you will still probably notice some die-off, and you might notice some symptoms of the intensity of the healing, because this is a really intense healing protocol. That's why you're doing it. So reasons for starting here on full gaps versus intro. There's only a few. Generally, it's if you're pregnant, if you're breastfeeding. With those, if you are, we don't want you to be detoxing so heavily that you're pouring toxins into your unborn child or into your breast milk. And then if you're constipated, because when we're on introduction gaps, if you didn't notice, we took pretty much all of the fiber out. So if you are significantly constipated, full gaps is probably a better place for you to start. You can start healing while still having in that fiber, so you're still able to really process your bowel movements out. All right, length of time. So this just kind of depends on you. Depends on if you want to start here and stay here. I have seen people heal here on full gaps without even going to intro. But you might need to do, again, we keep that 2-year mark in mind. You might need to do full gaps for a few months and then go back into intro and then go back into full. Very dependent on you and your body and what your body needs at the time. All right, and then the foods in full gaps. So what we're doing with full gaps is any meat, any seafood, any non-starchy vegetables, basically just not potatoes, sweet potatoes, and corn, any fruit, animal fat, fermented veggies, cultured dairy, meat stock still, bone broth if you've first gone through intro. If you're starting on full gaps and you haven't gone through intro, then we want to start with the meat stock. Eggs, dairy products, sprouted beans, nuts, and seeds, and the flours made from them. And then what we're not doing are the processed foods and synthetic chemicals, like we talked about as the offending agents. The starchy vegetables I just mentioned, grains and flours made from them, including gluten-free flours and sprouted grains, sugars, anything other than honey, pasta and couscous, rice, quinoa, most beans, chickpeas, and hummus. So that is full gaps, and that's a really good place to start. If you're not sure, can I really do this? This is a good place to start and try to work toward that. After you finish full gaps, then you would move on to WAPF, or the Weston A. Price Foundation, which is basically a foundation that promotes properly prepared whole foods. So once you've done this 2 years of healing, then you are ready to move on. We don't ever want you eating fake foods again. I don't ever want you eating processed foods and chemicals. Once in a while, okay, your body will handle it once you've healed. But the main way that you should be eating would be this Weston A. Price, traditional foods, prepared properly, and nourishing, timeless foods. All right, so a lot of people ask me, well, why would I need to work with a GAPS practitioner? Or why do people come to you? Why can't I just look at your slides, read the book, and do this on my own? You can. You totally can. However, I get a lot of people come to me after trying it on their own for a long time and saying, I'm not getting the healing that I thought I would get. I'm not getting the healing that other people say they got on GAPS. Why? And there's reasons behind that, because GAPS can be hard and intricate, and everybody's body is different. So yes, you can look at slides, you can read books, but everyone's body is different. And so you might need someone to walk through this with you. You might not. You might be able to walk through it yourself and find amazing healing. But if that's not you and you feel like you're a little more complex, you have a lot going on, you have both the mental and the physical going on, you're not sure about the cooking, or if you try it and you're saying, I'm not finding the healing, then it would be appropriate to find someone to do this with you. So the guidance available, there's certified GAPS practitioners like myself that have gone through a course. We are people who have other healthcare experience, and then we come into the GAPS world as a practitioner. There are certified GAPS coaches who are really great at helping with the cooking and the food aspects. They are generally not have not had careers in healthcare previously, but they have experienced GAPS, have done it with themselves or their kids, are really highly knowledgeable in the cooking and the preparation of the foods. There's the Getting Started on GAPS course, or the GSOG course, written and created by Amy Hollie, the other practitioner at Be Well Clinic. This is an amazing place to start. If you are just saying, you know what, I think I want to do this. I'm not ready to jump in head first, but I really want to learn more about this. I want to take the time to prepare, the necessary time to prepare, know what I'm doing, know what I'm getting into, know how to make the foods, just really start well, so that you're not saying, I'm going to start my 2 years, and then halfway into that, you're realizing, oh, I'm doing it wrong. I'm making the food wrong. I don't understand these different concepts. So the Getting Started on GAPS course is a great place to start to really get you very, very well prepared as you go forward in GAPS. There's a baby GAPS course that I created. This is based on my work, based on the GAPS protocol, and then based on my work professionally, and then also as a mom. Professionally, I'm seeing so many kids that are just very, very sick nowadays with autoimmune issues, with eczema, with poor sleep, colic, digestive problems, things that we just used to see in our elderly population, we're seeing in our babies. And so I created the Baby GAPS course to help parents use babies' first foods between ages 4 and 8 months, generally, to use babies' first foods to introduce the GAPS foods in a strategic way, a little different from when you're doing it as an adult or an older child, specifically for in a way strategic for a baby. So you can start them off right so that they can heal and seal that gut right from the beginning. If there was anything, environmental things that offended the baby, caused toxins to come in, anything passed on from mom or dad, anything from medications or vaccines, or from health issues, or just if your baby is struggling to sleep or has colic or rashes or anything there, this Baby GAPS course is for you. And then there are GAPS books written by Dr. Natasha Campbell McBride, who developed the GAPS healing protocol. There's one specifically on the gut and psychology. There's one specifically on gut and physiology. So you can kind of decide which one you'd like to read. Both of them go through the GAPS healing protocol, go through the intricacies of GAPS, way more than I was able to go in this short presentation here. There's a book specifically for vegetarians or anyone considering becoming a vegetarian. There's a book written by Dr. Natasha regarding heart health and how to heal your heart through your nutrition. There's a lovely book called GAPS Stories that is just testimonials of people all over the world who have been using GAPS to heal and have done so in amazing ways. And then GAPS.me, that's the official GAPS website, and they have FAQs and tons of resources, blogs, just really good information there. How to find GAPS practitioners or coaches, all the resources that you could want would be there. All right, and then you can also contact us here at Be Well Clinic. So bewellclinic.net, you can schedule an appointment, you can schedule an inquiry call. We'd be happy to talk with you and see if we'd be able to, how we'd be able to help, or you can just schedule a full appointment yourself. or shoot us an email at office@bewellclinic.net. So we are here. We are always putting out free content, blog posts, and videos. We want to be here as a resource for you, for anyone who wants to get started on GAPS, anyone who wants to start learning how to heal themselves and how to heal their children. We are here as a resource for parents, for you to really feel empowered and like you know what you're doing to help your children. So if we can be of any service to you, please get in contact. We would love to talk. All right, thank you so much for being here today. Thank you for going through these last 45 minutes with me. Again, if you have any questions, reach out either to us here at Be Well Clinic or go to gaps.me and see, you can search around and see if there's anyone close to you who can help you, or if you can get your questions answered in the FAQs. But again, thank you for being here. I wish you well on your healing journey, and I hope to hear from you.